Hey guys, I am Dr. Ko, a hair transplant surgeon in Korea. Today I will be explaining the differences between FUT and FUE. Please enjoy!
Today's question, FUE or FUT. Which one gets you your mojo back without leaving you looking like a science experiment? Let's find out, and with a real doctor, not just a guy who Googled it at 2 a.m. This is Dr. Ko. He does this stuff for a living, literally. Doctor, FUE, FUT, what's the difference?
Let's start with FUT, also called the strip method. We remove a narrow strip of skin from the back of the head, usually 1 and 1.5 centimeter wide and 10-20 centimeter long, depending on the number of grafts needed. That strip is then dissected under microscopes into follicular units, usually 1 to 4 hairs each. Those are implanted into balding areas. The upside? You can harvest a lot of grafts in one session, which is great for large coverage. The survival rate is high because the follicles are handled delicately under magnification. The downside is the linear scar left at the donor site. We close the incision with sutures, and if the patient likes short hair, it might show. But with good closure technique, the scar can be very thin, even less than 2 millimeters wide.
Okay, so that's FUT. What about FUE? Sounds fancy.
FUE stands for Follicular Unit Extraction. Instead of taking a strip, we extract individual follicular units one by one using a punch tool. Usually 0.8 to 1.2 millimeter in diameter. There's no linear scar, just tiny dot scars that are barely visible, especially with longer hair. The procedure takes longer than FUT, and the grafts are more sensitive during extraction because you're separating each one from the surrounding tissue. But it gives you flexibility. We can extract from the back, sides, even the beard or body in some cases. And most patients prefer FUE now, especially in Korea, because recovery is faster and there's almost no visible scarring. It's also the go-to method for hairline design or people who like short fades.
Okay, one is surgical lawn mowing, the other is follicle tweezing with a robot arm. If you want more hair and don't care about a scar, FUT. If you want no visible scar and a faster healing, FUE.
Also, FUT is usually more efficient if you need 3,000 grafts or more. It minimizes transaction cost per graft. FUE is best when the priority is healing time, flexibility, or aesthetics. In Korea, we often use advanced tools like the Gramax motorized punch for FUE and sapphire blades for implantation. Sapphire makes finer incisions than steel, reduces trauma, and allows higher density placement. And we store extracted grafts in cold preservation solution, not on gauze, to protect viability. These are live tissues, not Lego pieces.
And you're doing all this in Seoul?
Yes, Korean clinics are known for high engraftment rates, dense hairline design, and minimal scarring. We treat a lot of international patients who want top-level results without paying $15,000 in the US.
Alright, so now you know. Your hairline can be reborn. Just choose the right doctor.
If you're ready, we'll help you do it right, safely, precisely, and naturally.